continuing our discussion of how do you run your practice at a high level instead of letting patients drag it down to a low level, please understand that it's not the patient's fault. They have been miseducated by generations of chiropractors before you who told them that chiropractic is backache therapy. Now they come to you who wants to practice at a higher standard, and you have to raise them up. They will constantly try to drag you down to where they feel comfortable. They've been raised in a world of inductive thinking, and they will always go back to where they feel comfortable. It is up to you to make them comfortable at the higher level. You can't do that by accepting them for symptoms, hoping to change them later. And that was the next part of this question. Is it all right to accept them on a backache level in the hope that later on you can convert them? The only thing you're going to convert them into is a prevention of recurrences of backache. The principle of which I'm suggesting has nothing whatsoever to do with that backache. It's that kids without backaches should be kept subluxation free, and that all people with or without backaches should be kept subluxation free. Once you step down to their level, you cannot then bring them up to yours. So you have to keep both feet on firm ground. I know you feel moved by compassion. I know you want to help people. But damn it, if people are being dragged down in the quicksand, you'll never help them if you go in beside them. Offer them help. Stand with both feet on firm ground and throw them a rope. But they've got to have the courage and the conviction to grab a hold of the rope and be pulled out. The moment, and what they're going to say is, oh, I can't do that, I can't do it, please come in here and help me. The moment you go in there beside them, you're finished. You not only can't help them, you can't help anybody else. You've got to keep your feet on firm ground, and it's not easy when you first go into practice. It's certainly not easy when insurance companies are paying you $150,000 a year to lie, cheat, and steal. And the more you're prepared to lie, cheat, and steal, the more money they'll pay you. I didn't say it was going to be easy. I merely said it was going to be right. Practice with integrity. The question was, how do you get your practice up to a philosophical level and keep it there? And these are the answers. You don't first step down to where the people are. You just show them what you have instead. Listen to them, let them talk, and then offer them this instead, not as well as. Now the question comes up, well, what do you do about those people who won't do it your way? Don't you have a moral responsibility as a chiropractor to help those people? I mean, you can't kick them out of the practice. That's not fair to them. Yes, you can kick them out of the practice, and that's the only thing that's fair to them. Well, don't you have a moral responsibility to help their backache? No, you have a moral obligation to teach them chiropractic. You have a moral obligation to serve them the way you serve, not the way they want to be served. You have a moral obligation to all of the other people who will never become patients if you practice backache chiropractic. Look, common sense, let's just talk numbers for a minute. I hate to get down to venal things, but let's talk about this. How many backaches are there in your community compared with how many people? The question is, do you want to deal with the backache people or all of the people? Most chiropractors are running what I call a revolving door practice. A backache patient walks in, or a stiff-neck patient, they spin around for 8 or 10 or 12 times, then they go into maintenance for another 3 or 4 visits, and then they're gone. Every patient you ever have in practice is going to leave you for one of 2 reasons. First reason is that they get well. They came in for their backache, it's better, who the hell needs you anymore? They know very well that if the backache comes back, they can come see you again. Why should they pay you for the 3 years in between? When they get well, they're going to stop coming. Maybe they'll stay for maintenance for half a dozen visits, then they forget it and get tired of it, especially if it's once a month. Very easy to forget once a month. Once a week is a whole lot easier. But the maintenance chiropractors usually don't have the guts to say once a week, so they go for once a month. Why? Well, they can only afford it once a month. Hey, why don't you see them once a week and charge them once a month? Ever think of that? But chiropractors don't do that. They water down their chiropractic for what they think the patient will accept. So when the patients get well, the patient stops coming in. Of course, patients stop coming in for other reasons. Supposing they come in half a dozen times and they don't get well. Supposing their pain is caused by kidney stones or a tumor of the prostate gland. You think that's going to go away in half a dozen visits? What happens to the patient who doesn't get well? You know the answer. They stop coming in. I tried chiropractic, and here's where the mixer has a much better chance than the straight chiropractor. Because with a straight chiropractor, if you try 8, 10, 12 times, they don't feel any better, you're finished. The mixer tries 8, 10, 12 times, they don't feel any better. He can always try something else for 8 or 10 or 12 times. Let's try some diathermy. That doesn't work. Don't go away. We've got some ultrasound. That doesn't work. We've got something else. They can always keep it going for at least a little bit longer. If you want to practice backache chiropractic, at least use your brain. Go into all the shake and bake stuff. Patients who get well stop coming in. Patients who don't get well stop coming in. You're damned if you do and you're damned if you don't. They're going to leave you if they get well. They're going to leave you if they don't get well. Now what are you going to do? Very easy. You stop treating diseases. And you give people all of the good reasons for staying subluxation free. Not just the backache people, but all people. Not the one person who comes in, but the husband, the wife, and all the kids. Common sense says you'll have a bigger and better practice that way. But you can't go on charging them your old insurance rip-off fees. Of all the garbage chiropractors took from the medical profession, the worst thing we ever took was their fee system, based upon a half a dozen visits and out the door. If you want to see a husband and wife and 3 kids every week for life, you can't charge them $25 per person per visit, or $35 as it is now in some states for chiropractic. What chiropractors are charging is whatever the insurance companies will bear. If you want a husband and wife and all the kids to come in on a regular basis, week in and week out, you've got to make your fees reasonable. And I don't propose to tell you what reasonable is. Let me ask you this. Those of you that are married and have a couple of kids, if you wanted to see a chiropractor with your family, with your wife and your kids, every week, could you afford to go to you? If you can't afford to go to you, nobody else can either. So what they do is they cut down the visits. Let's start to structure chiropractic fee systems according to the chiropractic needs of the community, not the medical needs, and not what the insurance companies tell us. That's a whole different answer, a whole different set of questions. All right, how do you raise the level of your practice? I think we've talked about that. How do you keep it up there? By cutting out all of the people who won't play in your ballpark. They want to play some other game, that's terrific. They can play it, but not in your ballpark. You have to get rid of them out of the practice. Don't you have an obligation to serve them? No, you don't. What if the guy wants surgery? You can do that because it's his right to have it? It's his right to have it, but not from me. It is his right to have from me that which I practice, which is my particular brand of chiropractic. If he doesn't want that, there's lots of other chiropractors around to give him what he does want. All right, let's move on to the next question. When do you educate them? Are there some patients that are bad for your practice? Well, we already addressed that. Do you have a moral obligation to those who are bad for your practice? Yes, you have a moral obligation to kick their ass out and keep the practice clean. When do you educate them? Before you lay your hands on them. This is a very difficult question because people can't listen to you when they're subluxated. The guy's in so much pain, he can't hear what you're saying. Is there any point, if a guy's all stooped over and twisted up in pain, is there any point in giving him a 1-hour orientation? The trouble is, if you work on his spine, his pain goes away, you'll never see him again. Fortunately, in my kind of practice, you don't see that many people twisted up like pretzels. See, the vast majority of people who come in for the right reasons, and they bring in the whole family. How do they get that concept? They heard about it from one of my other patients. One of the nice things about this kind of practice is it's a referral practice. People get turned on. They get emotionally excited. You know, people don't get emotionally excited when their backache goes away. Supposing your television set doesn't work. You take it to the TV man and he fixes it. What are you going to do then? Call up all your friends and say, hey, my TV's fixed. This wonderful man fixed my TV. You don't give it. I mean, it's what you paid him for. People come to you, they come to have their backache fixed, you fix it, they pay you. What are they going to do, tell their friends? My kind of chiropractic gets people excited. They really get emotionally excited about the concept of a life free from vertebral subluxation. You realize the burdens you're taking away from people's lives, the opening, the opportunity, the wonderful philosophy you're sharing with them? Yes, they get excited about that. Why do you think it is that that kind of chiropractor refers more prospective students to chiropractic schools than all the other kinds put together? Walk into the office of the kind of chiropractor I'm talking about, and he or she is proud of what they're doing. They're alive. They're charged up. You can't get excited about sick people. I mean, the backache practice, any negative practice, any sick practice, it's not much better than being an MD. You know, all these negative people coming in. What do you take home to your family at night? Negativity, pain, soreness, dejected attitudes. That's no way to live your life. My God, that's the great thing about being a chiropractor, is that you're not dealing with sickness and pain and negativity. You're dealing with life and positives. You're sharing a philosophy. You're turning on life. People have pains. That's not your problem. It's not even their problem. They get above their pain. And they get excited about what a wonderful thing this is, and that's what they share. Now, you've heard about my practice in Spring Valley. Some of you have been to see me in my practice. You know we saw, 300 patients a day, 7 days a week. For 16 years. Why? What builds that kind of a practice in a crummy little village of 3,500 people? What builds that practice? Excitement. Why did you come here again to hear me speak? Whatever I'm saying you've heard before. Listen to my old tapes, I said the same damn thing. I haven't changed what I've been saying in 30 years. Why do you come? Because you remember that when Reggie talks about chiropractic or this whole principle, he sets himself on fire, and it's kind of nice to come and get warm once in a while. Let's be honest, isn't that why you came back? To get warm, to share the feeling, the love, the enthusiasm, the strength? That's what the patients come in for. We've had patients come in the office and get so excited talking with each other, they didn't care if we checked their spine or not. They came for the philosophy. I've had people tell me, if you only had that box out in the waiting room instead of inside, we'd have put the money in there and gone home. We didn't need anything more. That's the difference between this and a backache practice. It's just a wonderful way to live your own life. And we'd see our 300 patients, and that we'd go out lecturing at night or dancing or what the hell else. Energy, energy, energy. When you deal with life, that's what you share. When you deal with negativity, that's what you share. That's what you take home. You know, all the cardiovascular specialists, what do you think they die of? Cardiovascular disease. I mean, known fact. All the cancer specialists dying of cancer. I don't know what the gynecologists die of. But it's just so great dealing in life. You might as well be a part of it. Do you realize something as chiropractors, you're going to be in this life and in this practice for a long, long time? You don't want to spend it in negativity and backaches and problems. Spend your time in sharing and giving and loving. That's who you become. That's what your feedback is. That's what your life comes to mean. And when the patients see this and feel it and experience it, that's the way they go out. You change their lives by your attitude. And what happens is they want to come in. Let me ask you this. Do you have any negative patients? Do you have that one where she walks in and says, oh my God, she's here. Not her again. You ever get those? How you hate to see those. Well, you respond positively or negatively to people, and people respond positively or negatively to you according to what you're putting out. What are you putting out in the office? What kind of energy? Are you really delighted to see the life in their body, or are you scared of the backache in their body? I think that's where some of our schools render such a disservice in warning you, threatening you with all the diseases that are going to catch up on you if you're not watching very carefully. They forget to tell you about the life you're opening up. Watch out for the disease because it'll get you. They'll put you in jail for that disease. You'll hurt the patient with that disease. What about the life? That's what we should be sharing with these people, and that's how you build a practice. And when people come in that are negative and they want to drag you down to the past, kick their butt out of there for your own sake and for the sake of all the other positive people who should be a part of your practice. Don't respond to the negative few. Build your practice out of the positive many, and that often means the unsubluxated. I mean, give the others a chance. When people come into you and they're sick and they're miserable, that's to be understood. They are subluxated after all. Don't be in a rush to kick everybody out. But if somebody refuses to uplift their standards to meet chiropractic, chiropractic shouldn't stoop to meet them. All right, next question. Totally different topic. Aren't symptoms sometimes a valid criterion for determining the presence or absence of subluxation? At least to a certain degree, in order to tell you when or where to adjust. Answer, no, never. Or is that copping out? Symptoms can occur as a result of vertebral subluxation. But the same symptom can occur without subluxation. And the same symptom can stay after subluxation is gone. If you get a splinter in your finger, it hurts. What are you going to do? Well, pull it out. So I pull it out. Now, does it stop hurting? No, it hurts more. The symptom doesn't tell me whether the splinter's in or out. I need other valid criteria. There are two answers to this. The first one is that symptoms are never a reliable determination, even on the location of subluxation. How many times do we see the patient becoming the doctor? The chiropractor checks out the spine, determines there's a subluxation here, goes to put in the force, and the patient, especially if the patient's another chiropractor, says, oh no, it's not there, it's lower down. What's lower down? Well, it hurts lower down. Is where it hurts is not what we're looking for. We're looking for subluxation. You mean you're looking for the cause of where it hurts? No, I'm not even looking for, I don't care where it hurts. I don't care if it doesn't hurt. If symptoms are your criterion, what are you going to do when there are no symptoms? Means no adjustment? Let them stay subluxated? Subluxation can certainly cause symptoms, but not necessarily at the site of the subluxation. Subluxation can cause spinal or paraspinal areas to become hot or cold, but not necessarily at the site of the subluxation. After all, subluxation affects nerves. Can't there be physiological change as a result of the subluxation anywhere along the course of those nerves? Does it have to be at the origin, at the nerve root? Isn't it possible that subluxation here will cause pain lower down, or heat lower down, or cold lower down, or paralysis lower down, or higher up? What about all the recurrent fibers? No, symptoms are absolutely no valid criterion of where a subluxation is to be found, or if one is present. When subluxation is gone, all of the symptoms may still be there. In fact, some of them may well be worse, as we discussed a little while ago. When nerves that have been blocked are now free to transmit impulses, the patient may feel an increase in symptoms as more of the impulses are reaching the brain for interpretation. If you want to get rid of those symptoms, the best thing to do is subluxate them again. When the nerves are all dead, they're going to feel a whole lot better. No, symptoms are never a valid criterion for when or where to adjust. All right, next question. When people, particularly kids, we talked earlier about kids becoming toxic when they have fevers or they're fighting off some kind of infection or poison, they don't seem to be able to hold an adjustment terribly well. So the question is, when kids are so toxic they can't hold an adjustment, how often is it okay to readjust? I want to add to that my own part of the question. Well, what about over-adjusting? Can't that cause damage? Let me answer the second part first. There is no such thing as over-adjusting. How can you say that? All the chiropractic textbooks warn about over-adjusting. Yeah, they're just being sloppy in their language. They're talking about over-manipulation. An adjustment is what? The innate intelligence using available forces to correct a subluxation. It's never going to do that when it shouldn't. Adjustments are done by the innate intelligence, not by the chiropractor. So there's no such thing as over-adjusting. Well, can't frequent adjusting cause, like, arthritis? My grandmother used to say, if you crack your knuckles, it'll make arthritis, right? So when you crack the bones of the spine, can't that do the same thing? In the first place, there's no indication whatsoever that cracking your knuckles causes arthritis. That's another old wives' tale. Second, we don't even know what the cracking noise is, and it has no relationship whatsoever to subluxation or adjustment. And third, to go back to our original, if an adjustment should not be made, it cannot be made. You can subluxate a body that is not subluxated, but you can't adjust the body that is not subluxated. How do you over-adjust? Well, doesn't too much adjusting loosen the ligaments? No, it doesn't. What does it cause? Arthritis. Look, if adjusting caused arthritis, everybody would have arthritis. Every spine is adjusting itself hundreds of times a day. And it doesn't cause arthritis, and it doesn't cause loose ligaments. I'm sure some of the manipulative techniques that are used have potential for damage. Whether using them over frequently or over manipulating could cause weakness or damage, I don't know. I will allow for the possibility, although I have no first-hand evidence of it. Certainly there's no such thing as over-adjusting. There is such a thing as over-subluxating, or staying subluxated too long. And how long is too long? I would say 1 split second longer than you have to. That's too long. All right, next question. Oh, here we go again. What if you determine a B6 deficiency? How do you know if it's causing the subluxation or if it's being caused by the subluxation, reducing the body's ability to utilize B6 or any other vitamin or any other substance? What do you do when you find a nutritional deficiency? Answer, you don't find a nutritional deficiency. There's no way you can find a nutritional deficiency except by looking at clinical symptoms, and that's not your job, that's the MD's job. How do you treat a nutritional deficiency? You don't. That's not chiropractic. Now we have somebody, and I have to kind of pinpoint the question a little more, somebody who uses AK, applied kinesiology, to determine whether this body needs any particular nutrient. I know that in answering this question, as well as some of the other questions, we're going to hurt feelings. I have a choice as to whether to treat everybody nicely by lying or saying nothing, or call them the way I see them and hurt feelings. And I know there's a lot of people going to be listening to this tape who are going to hate Reggie because Reggie doesn't like their thing. You know, people come to Reggie and say, hey, how come you don't use my technique? That's very obvious why I don't use your technique. Because I like mine better. Obviously. So when I say, well, I don't use your technique because I like mine better, then I'm being arrogant for liking mine and I'm being resistive for not accepting yours. Nevertheless, every chiropractor uses his or her individual technique. I'm going to have to talk about applied kinesiology, which is used by some chiropractors to determine the presence and or location of vertebral subluxation. As an attempt to locate and identify vertebral subluxation, it falls within the purview of chiropractic principles. When it is used to identify other things, it falls totally outside chiropractic. For example, when it is used to determine nutritional deficiencies. The first time I heard of applied kinesiology, it wasn't called that. It was long before George Goodhart. It was when I was giving my seminars at my practice up in Spring Valley, New York, back in the very early 1960s. And a chiropractor by the name of Borton, I don't remember terribly well, came down. He said he wanted to show us something brand new in chiropractic. And he came down from upstate New York with this idea to determine what substances are good for our body and what substances are bad for our body. And lo and behold, his method was muscle challenging. He challenged muscles, and when they were weak, he would, well, with me, he determined that I was smoking the wrong brand of cigarettes. I was smoking Pall Mall at the time, or Pall Mall if you prefer. And he held them in my hand and showed that one muscle on one side was weak. When he changed it to Camels, that muscle got stronger. And that proved I held these stupid cigarettes in my hand. And I'll tell you something, it worked. One of the most dangerous things about AK is that it works. If you're suggestible enough, or if the chiropractor doing it is fraudulent enough, or if you cheat enough. At another time, I had it done to me in France by a former student of mine. I went in to get my spine checked. I've been traveling on planes. Here I go to get my spine checked, and I remembered him as a chiropractor. Now he goes and does this muscle testing thing, and he's cheating blatantly. When he's pushing down on my hand, he's pushing as hard as he can, and it goes down and shows me how weak it is. Then he does pushes on my neck somewhere and presses again, and he's changed the direction of his push. Now he's pushing into my body. Of course the damn thing won't move. I can resist anybody pushing my hand into my body. You know, I mean, my feet will give before my hand will give when you're pushing in that way. And this is what I find with AK. It's just blatant cheating, has no validity. It works on anything. You can tell people that holding this packet of sugar in their hand will make them weak, and it does. You can have them drink green water and tell them that'll make it stronger, make an arm stronger, and it will. I don't understand the way this thing works totally, but I know it's suggestibility on the part of the recipient, or outright fraud, or unintentional fraud on the part of the operator. I don't think it has any validity whatsoever. Now, having offended 40% of the chiropractors, I'm going to want to find ways of offending the other 60. Certainly, if AK has the intention of determining subluxation, then I think a discussion of it belongs in chiropractic. When it has other intents, as it now does, it used to be a method of determining subluxation. Now it's become a method of evening out the legs. Look at the faulty reasoning here. Somebody set up a thesis, totally unproven, that when your legs are even, you're not subluxated. Well, subluxation could cause one leg to shorten up. Yes, it could. Doesn't necessarily. Another subluxation could cause the other leg to shorten up. Perhaps the subluxation could cause the leg to lengthen. The belief that they're perpetrating here is that if the legs are even, you have no subluxation. You can have 4 subluxations balancing each other out. They don't care about that. Then when they found that pushing on these bones of the spine didn't necessarily straighten out the legs, they changed the technique. The objective did not become the correction of subluxation. The objective became the straightening out of the legs, like the activator people. Told you I was going to go after the rest of them. The activator people believe that the only criterion that needs to be used is the leg balancing. When clicking this stupid dental impactor, you know, the dentists buy it for $20. Chiropractors have to buy it for $150. They click this thing on the spine. If that doesn't click out and check out the legs, they then click it on the gluteus maximus muscles or somewhere else, and that'll check the legs out. The person, if they were subluxated, are still subluxated. The instrument now has been used for straightening out legs instead. And AK is doing the same thing. It left the spine because it didn't work on the spine and became other things. It'll work on anything if the operator is sufficiently convinced and if the operator can sufficiently convince the other person. I know I've hurt feelings. I really do apologize. I shouldn't have made a joke of it, but I just think it's one more fraud that chiropractors are perpetrating upon the public because they don't have any better criteria. We've discussed this before, and I'll say it again. I believe there is one totally valid criterion that chiropractors can use. Based upon our own philosophy, there's an innate awareness of every innate need. When a subluxation exists, the body's own muscles are being used to try and correct it. If we can feel what the body's muscles are doing, concentrate on that and identify it, we know where to put in a force to allow those muscles to complete their work. It is the only criterion I know, the only analytical procedure that I know that is totally consistent with our philosophy. That does not mean that I believe all other analyses are invalid, but I certainly believe they all have shortcomings philosophically, except that particular one. It's the only thing I know that is not inductively trying to determine where a bone belongs, but is deductively allowing the innate intelligence to make the decisions. The innate intelligence determines what vertebra needs to be moved, which muscles to use, which direction. The chiropractor merely tries to learn from the innate intelligence. I remember BJ saying once, everything that science knows about the human body, everything that science knows about the human body, it learned from the innate intelligence. And here's the innate intelligence telling the chiropractor what my body needs specifically, because it's my vertebra that my innate intelligence are moving. And all we have to do is follow the direction of the innate intelligence, put in the force where we believe it can be best used, and then we'll see very quickly whether we're right or wrong. The nice thing about it is you use the same criteria exactly in a post-check. One of the most disturbing questions I've been asked by chiropractors hundreds of times all over the country is, if you don't listen to the crunching sound, how do you know when you've done the job? If your criteria were no good to determine when you've done the job, they were no good to determine when there was a job to be done. Use exactly the same criteria as in a post-check as you used in the pre-check. Am I disagreeing with BJ's pattern work? Yes, I am. There are shortcomings. BJ's pattern work was all well and good to tell you when to adjust. He said when there's a consistent and persistent pattern, it means the body's not fully adapting. A living, dynamic body changes all the time. Every time you take a reading, it should be different. And if it's not, if you get a consistent and persistent reading, that means the body's not adapting, and the most likely cause of that is vertebral subluxation. Well, the most likely cause, but not the only cause. Furthermore, now it's told you when there's a subluxation, now you have to find it. How do you know where the subluxation is? And BJ said, that's easy. It's at the atlas. Now, as long as you believe there's only one place for subluxation, that system may work for you. But I have to find where the force can be utilized. I don't put in nearly as much force as BJ did. I mean, I saw him work on an atlas, and that whole spine rattles up and down. I'm damn sure every vertebra got enough force to correct subluxation. Have you seen the slow motion movie with his hair flying in all directions? You better believe there's a lot of force in there. Well, I don't want to use that much force. So I need to put the force exactly where the subluxation is, and I agree with BJ's later thinking. It doesn't have to be at atlas. I still recognize that atlas is the most freely movable vertebra, therefore the one most likely to subluxate. Certainly it contains more nerve fibers than any other individual vertebra. I would say if I had to pick one, I'd pick atlas. But I don't have to pick one. And let's remember that Vint Logan proved that by putting your force in only at the sacrum, he got just as good a result as BJ did putting it in only at the atlas. Fortunately, we're not limited to a dogma that says one or the other. We're allowed to put in the force where we have reason to believe the innate intelligence can use it. And I'm going to skip now to another question in that regard that somebody asked me, and it's written in here somewhere, concerning specificity of technique. And let me see if I can find the actual question, because I don't want to put my words into somebody else's mouth. Now, I can't see it offhand, but it says essentially, don't you think that some of these super specific techniques are just kidding themselves? And the guy who just puts in general forces is going to get just as good a result. Now, I don't believe that for a minute. I certainly believe that any forces put into the spine, directly or indirectly, have the capability of being converted into an adjustment. But I also believe, by the laws of physics, that the more closely the force approximates the location, and more particularly the line of drive at which the force can be used, the more accurately the force goes in, the less force is required to do the job. When you put in non-specific general forces, it is possible they can be used by the body to make adjustments. It's possible also that they can be thrown off without making adjustments. That's also true of a specific force. It can either be used or not used. I personally believe the likelihood of the force being used increases as the accuracy and specificity increases. When you use traction moves, putting forces into large sections of the spine, like lumbar rolls and cervical rips, aside from the danger involved, which we'll discuss in a moment, when you put a force into a larger area, which vertebrae are most likely to move? Well, the most freely movable vertebrae. Good. Which ones are those? The ones that are not subluxated. So you make all kinds of pretty noises. You go crack, 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 crack. You say, oh, wasn't that a good one? But the person is still subluxated. Also, it misinforms the patient. They now believe that the cracks are important. And they'll say to you things like, I couldn't get it to crack today, huh? Or chiropractors will say, how come every time they come in 10 minutes later and they need another adjustment? Meaning, I can crack their knuckles again. Cracking your knuckles or their knuckles has nothing to do with adjustments. My fingers have no vertebral subluxation, yet I can make the knuckles crack. The bones of or the joints of the fingers now are exactly where they were before I did that. Anytime you open and close an articulation, you can make that sound without changing the position of the bones. So the spine is capable of making a noise when it subluxates, when it adjusts, or any time in between. Anytime you move a vertebra or any joint through a range of motion, it's possible to make those noises. And it's possible for the vertebra or other joint to go exactly back where it was before you started. There is absolutely no validity of criterion in making the spine go crack. And the fact that it cracks doesn't mean they were subluxated before or they're no longer subluxated now. So that is a criterion we can't use at all. Oh, what about over-adjusting? That was the other part of that question. We said there's no such thing as over-adjusting, although there could be over-manipulation. All right, that's done with that question. Let's move on to the next one. What about those people who can't hold an adjustment, and then you put them on a dietary supplement and they hold their adjustments beautifully? Presented with this one again tonight. What about a patient that I was treating for a period of time and I could never get rid of his back problem until I put him on an iron supplement, and then all of his back problems went away? As far as I know, I can make no logical relationship between iron supplements and disc problems. I can't think of anybody else who could either. I see coincidental relationships. More than that, I see the placebo effect. When you tell somebody that I want to try this, it may help your backache, it may help their backache. Anything that will get rid of symptoms emotionally will get rid of the symptoms without incidentally correcting the problem. Somebody reminded me tonight of a discussion I had many years ago about concept therapy. Can't you make the pain go away with concept therapy? Yes, you can. You can make backaches go away with concept therapy. You can make it go away with massage. You can make it go away with iron or muscle relaxant shots. The example that was brought up is, what about somebody who has a tubal pregnancy? Now, tubal pregnancies tend to hurt. And if you use concept therapy to talk the person out of their pain, or any other placebo technique, you give them an adjustment and say, this will make your pain go away. And if they believe it and accept it and translate that thought into a nerve-deadening activity, the pain goes away. The patient feels better. And they don't seek the medical intervention that may be necessary to save their life. Chiropractors who chase symptoms are doing something very, very dangerous. If the patient really wants to get rid of that problem, and they wish it hard enough, they can make it happen. I've had this happen in my practice, and I didn't even want to do this. Back when I first started in practice, I used to use a neurocalligraph, the old neurocalamity. And here I was, I wouldn't touch a person's spine till I took 3 consecutive readings and established a pattern. And here I sat this fellow down, I took my first reading, and I marked it down, I did my orientation, sent him home, come back tomorrow. He came back tomorrow, he said, I don't know what the hell you did with that thing, but it's cured my headaches once and for all. I had my first decent night's sleep in years, and blah, blah, blah. Clearly, placebo effect. All I was doing was taking his temperature. I mean, that's all the neurocalligraph is a bipolar thermometer. I took his temperature and it cured his headaches. Why? Because he desperately wanted something, anything to cure his headaches. This is why medicine works. Take this, it'll make you feel better. Like the one fellow who's given a suppository for his headaches. Well, he didn't know what a suppository is supposed to be. He took it home and he swallowed it. Went back to the doctor the next day, and the doctor said, how do you feel? He said, for all the good that thing did me, I might as well have shoved it up my ass. Terrible. I am very much concerned about the placebo effect of these different things that we try. You can try almost anything, and if you believe it'll work and the patient believes it'll work, that'll make it work. Yeah, but isn't it possible, Reggie, that in some particular case, this iron deficiency is causing the problem to stay there? The B6 deficiency isn't stopping the person from holding adjustments? It's possible. It really is possible. But how in the world are you supposed to know? I don't know how much iron a person needs. I know if I give them too much, it's just as bad as too little. By definition, anything introduced into the body or manufactured by the body, which the body cannot use, is a poison. So I can't play around with somebody else's physiology, putting in unknown chemicals, try this, try that. I mean, that's called the practice of medicine. Try this and try that. Try it again, therapy. That's medicine. That's not what chiropractors do. Now, my position is, my job is to practice chiropractic. If they have backaches that stay there, that's unfortunate. I feel sorry for them, but I'm not going to go chasing their symptoms. Not even, yeah, but Reggie, if you could help him, you knew you could help him, wouldn't you? I hope not. I hope I would have the integrity to tell him, that's not what I do. I'm a chiropractor. I don't treat backaches. And if what I do on the spine is not what you want, you have to go somewhere else. What I'm doing on the spine is not meant to cure your backache. When you don't have any subluxations, if your body's able to heal and recover, that's wonderful. If it can't, let's keep the nerve channels open anyway. My job is to keep the nerve channels open, not to find the cause or causes of your backache. Once you start chasing causes, you're all over the place. One person will respond better to iron. Another one will respond better to muscle relaxants. I mean, medicine gets results with surgery. Maybe we should use that as a last resort. I understand that National College is now just in the process of changing its name to the Illinois College of Chiropractic Medicine, including minor surgery and pharmacology, and that they already have a half a dozen states to allow their graduates to practice those specialties and subspecialties as chiropractors. Now, as soon as that happens, all of the other schools are going to be mandated by state law, if they want to get their graduates licensed, to teach those subjects. And where do you stop? What does a chiropractor do? If it's all right to use iron supplements, why isn't it all right to use muscle relaxants? Or natural aspirin, as some chiropractors are selling. Natural laxatives. Well, what's wrong with taking prunes? You know, that's natural. It's not a drug. What's wrong with it is it's a violation of the principles of chiropractic. Telling people what to eat and what not to eat is a violation of our philosophy. Our philosophy teaches that only their innate intelligence knows what is needed. Yeah, but this works. I don't care if it works. I had a visit today from a chiropractic dropout who, when he first came to me as a chiropractic student, said, Reggie, I have this wonderful thing of pyramids. You know all about pyramids? My mother broke her arm, and normally they take about 6 weeks to heal. We put her arm in a pyramid, and she healed in 2 weeks. Isn't that wonderful? No, it's not wonderful at all. I don't know if it works. I don't care if it works. The fact is, our job is the correction of subluxation, not the mending of broken arms in less time than nature does it. Seems to me, if we start off with our own major premise that what is natural is perfect, you can't improve upon perfection. When you change what is perfect, what's the result? Imperfect is the only thing there can be. If what is natural is perfect, if it's perfect for this person's broken arm to heal in 6 weeks, then doing it in 2 weeks is unnatural and therefore wrong. Curing diseases faster and better is not our job, and is sometimes a violation of our principle. So no, I see no reason ever to stray from the practice of chiropractic into these other fields. Oh, here's another. This is a tough question. How do you find a good chiropractor to refer to? It's a hell of a question. Every chiropractor is faced with this. You have patients that are moving away here. I'm moving to Miami. Can you find me a good chiropractor in Miami? Well, yes, I've got one, but he's way over there in South Miami, and you're going to be in the north. Well, can't you find somebody closer? No. I have no objection to telling patients, drive for 3 or 4 hours. Find a good one. What is a good chiropractor by definition? Well, that's easy. One who practices the same way I do. All right? Isn't that what's a good chiropractor? So that a Pettibon man will send somebody to a Pettibon man. And a grostic man will send someone to a grostic man. They'll send them clear across country. Don't you go to one of those others. The toughness people have their own language. They say, don't go into one of those violent chiropractors. That's their language. Only go to one of ours. So it's no wonder we're getting all kinds of a bad rap in chiropractic. But it's very difficult to make a reference, a referral. We refer people to our own school of thought or who graduated from our own college or belong to the same association. The ICA chiropractor refers to an ICA chiropractor. The ACA chiropractor refers to an ACA chiropractor. Who a straight chiropractor refers to, I have no idea. There seem to be so few and far between. It is really an extremely difficult thing, and I don't know the answer. If you want to make a referral, it's got to be, I think, to somebody you know personally or somebody you talk to personally. I remember once getting a phone call from it's funny you remember names. It's got to be over 20 years ago. Because I was still in the original Spring Valley office. It's closer to 30 years ago. Patient called, said, my name is Reverend Waite. I want to come in as a patient. What school did you graduate from? First question, what school did you graduate from? And I told him. He said, well, how do you practice? And I told him. And he said, do you use, I forget, neurocalligraph? And just a lot of questions like this. Do you use toggle? And apparently I gave the right answers because he showed up. And he'd been trained by another chiropractor that you only go to somebody who uses this and this and this method. I'm not sure that's right. I don't really believe that the same technique is necessarily the best technique for all chiropractors. I think one technique may be better for me and another one for you. But it's extremely difficult to make referrals to people you don't know without calling them first. I care enough about my patients that if I have a referral to make, I will call the chiropractor. What I do is I tell them, go down there and open the yellow pages and give me the names of the chiropractors who are conveniently close to you. I don't know who the hell's in North Miami Beach and who's in South Miami. And look around, give me the list of names of the people in your area, and I'll try and find one from among those. And if I can't find one, I may call somebody else that I know who's practiced in that state for a while and knows them. Or I'll call one and ask him, what school did you graduate from? How do you practice? I have no shame in asking somebody, how do you practice? I believe in truth in advertising. I really believe that when the sign outside the door says chiropractor, when you go in there, you should get something that at least vaguely resembles chiropractic. I don't want them to go in there and find they're in a gut laundry or in an acupuncture center called chiropractic. I myself have gone to chiropractors to get my spine checked, and they've told me we don't do that. We just work on the feet. And that's chiropractic. What the hell right do you have to call it chiropractic? Where's my diploma? It says I'm a chiropractor. Anything I do is chiropractic. Go argue with us. And we wonder why the public is disenchanted with chiropractic when half the profession doesn't know what the word means and can't agree on what the word means. So yeah, there's lots of problems in making referrals, and I just don't know the answer. All right, here we are again, another version of an original question. When is it your responsibility to let people know that the cause of their subluxation is psychological or dietary or some other factor? Again, what about the cause of the cause? Well, I'm not going to waste too much time on this again. I think you know how I feel about it. How do you determine that their subluxations are caused or recaused or they can't hold adjustments because of psychological factors? What makes you a maven on psychology? Are you a psychologist? If you have a psychology degree, then maybe you think you have some expertise in the field. As a chiropractor, I have no way of relating. You know what I'd like to do as a chiropractor? Somebody comes in and says, Reggie, why can't I hold an adjustment? I said, well, why do you think you can't hold an adjustment? Well, I don't know. Maybe it's my karate that's doing it. Or they'll say to me, do you think yoga will help me to hold my adjustments better? I say, I don't know. You want to join a yoga class? Go ahead, and we'll see how. Every time you come in here, I check to see how many subluxations you have. We've been doing that for a while now. I know the state of your spine. Go do your yoga thing, and we'll see if it helps or makes it worse. Reggie, what kind of a bed should I buy? How the hell do I know? You think water beds make me hold adjustments better? I don't know. Go move into a motel someplace and sleep in water beds, and we'll check you. I think the water beds may help one person and hurt another. I think the same is true of yoga. Somebody who practices yoga under the tutelage of a master might in fact strengthen their spinal muscles. somebody else who goes to the airport and picks up a book of do-it-yourself and tries neck stands all by himself, maybe causing more subluxations than he's correcting. There's no one simple answer to these things. And why should I make the decisions? They're going to have to do it by trial and error, the same as I would. What about medical intervention or medical first aid for somebody who doesn't go to a chiropractor? Isn't there a need? Yeah, there may well be. It's not my problem. I don't have to have the answers for the whole world's problems. Well, don't you think I need a doctor? How the hell do I know? What makes me an expert on what's somebody else's medical needs? See, I tell the world up front I have no medical knowledge whatsoever. I have no qualifications to know when you need a doctor and when you don't. The very first time you make a referral to a physician, you're telling the world at large that you know who needs medicine. That's what you've said. If you send this lady to see an MD, oh, I have reason to believe she has a tumor, better get her off to an MD. Or you take her blood pressure and you say, well, hers is 220 over 140, I better send her to a physician. And then her sister comes in and she doesn't have 220, she has only 180. And you say, well, does that one need a physician or not? See, if you don't send her, you've already told her she doesn't need to go. You told her sister, I'm sending you because you need to go. Now, if I don't send you, what does that mean? It means you don't need to go. When are you going to send them? At 180, 160? What's your dividing line? Once you start playing the game, you're hooked. I don't play it at all. Do you think I need to see a physician? How the hell do I know? The only person who knows whether you need medicine is a medical person. And they always say yes. So I'd rather train them philosophically to make their own judgments. Well, won't you take my blood pressure? What for? I don't need it. What I need to do is check and see if you have subluxations. Yes, but my other chiropractor used to check my pressure regularly. That's fine. I don't do that. Physicians, any physician, you can walk into a drugstore, put a cord in the machine, you take your own damn blood pressure. It amazes me how chiropractors do things that people can pick up for 2 bits. Like their blood pressure, massage machines. You know, you can't walk into a barber shop in India to get a haircut without them ripping your neck in both directions before you leave. And they'll always use these little massages for the scalp. And chiropractors charge extra for that. Hey, that's $15 extra to use the little massage machine on there. God. Is it any wonder people have no respect for chiropractic when chiropractors have no respect for chiropractic? What about the need for medical intervention? I'm sure there is a need. I'm sure there are people who, if they don't get medical intervention, will die from that lack of intervention. And there are others who die because they get medical intervention. And who the hell are we to know the difference? It's crap shooting. And I'm not going to play the game. I'd much rather teach the patients how to think for themselves deductively than depend upon my inductive knowledge. You see what we're doing when you make medical diagnoses and medical referrals? You're going back into the inductive method. You've learned from books that this is the normal range and that's abnormal. Back into medical thinking that all people should have the same range of blood pressure. Totally ignoring the individuality, going by the national average yet. You've betrayed your deductive reasoning to practice medicine. That's all you're doing. Well, when they come to me, don't they expect me to know about their blood pressure? Doesn't the state law require it? Hey, you have a real problem there. See, you unfortunately were trained in medical diagnosis. And even more unfortunately, you didn't get a license until you were examined in medical diagnosis. Remember when you went for your state board licensure? They didn't ask you anything about chiropractic at all. The entire exam and the entire test was medical to see how well you can diagnose. And now if you misdiagnose, you're going to get hauled into court and all the state board members are going to testify that you should have known this stuff. And if you don't like that, change the laws. Right now the laws are against your kind of chiropractic. And if you don't want that, change the laws. What do you do about your mother who won't go to a chiropractor? Hey, she's not your problem. All you can do is educate her. If she doesn't want it, there's nothing you can do. You can't force her. I can't hold her down and jump on her atlas. But then, you see, when she hasn't gone to the chiropractor, then she comes to you and says, oh, I'm sick. Can you do something about it? You think I should see a doctor? She wants you to play the medical game. Well, I'm your mother. That's no reason for betraying chiropractic. Teach her all you can. It's tough to teach your mother or your parents. Remember, they're the ones who used to change your diapers. They know you don't know a damn thing. All the inductive stuff you ever learned, you learn from them. Listen to me, I know more than you do. I'm the authority figure. It's past your bedtime. Eat your spinach. Huh? And now they're going to ask you for your medical advice. And if they don't like it, they'll go to somebody else. I got a better idea. Withhold it in the first place. Give them no medical advice. All right, here's a question. Right out of Philosophy 801. One of Reggie's questions come home to haunt him. If a fly has an innate intelligence and a frog swallows the fly, does the frog now have more innate intelligence? It has the fly's innate matter. Does it also have the fly's innate intelligence? How much frog does the fly now have? Answer is very simple, of course. How much innate intelligence does the frog have to start with? 100%. How do we know that? Because that's the only way you can measure innate intelligence. It has no percentage, no quality, no quantity, other than its own perfection of being 100% of what the body needs. Since you can't have more than 100%, then at any circumstance, it always has exactly 100%, never more, never less. What happens to the innate matter of the fly? Well, that becomes reorganized. Some of it becomes waste. Some of it becomes the innate matter of the frog. What about the innate intelligence? The fly didn't have an innate intelligence to start with. It's not a thing. The fly was organized and reorganized itself intelligently. Well, does the frog do that now? Yes, but the frog always did. No change. All right? Cute questions. Good final exam question for Philosophy 801. Well, let's see. We have time here for a couple more. Should we market chiropractic with the idea of checking spines rather than adjusting spines? I think the marketing of chiropractic, first of all, is a very important point. Right now, chiropractic is not being marketed at all. What's being marketed is manipulative therapy for a number of conditions. If you're going to market chiropractic, it has to be for one reason only, staying subluxation free. Not with the idea that every time you go to the office you're going to get adjusted. My job is to check to see whether you need additional forces so that you can adjust yourself, or whether you're adjusting yourself beautifully as it is. I think you have to market the whole package and not a part of it. And that can only be done with, and we started on this before, it's worth continuing with it and finishing up on this point. You can only do it with continuing education. Patients come into your office from this inductive world outside. You spend an hour or an hour and a half teaching them a brand new philosophy of life. Then you turn them loose back into the same old world, which chips away at them again. And when the chips are down, they're going to turn away from chiropractic. They'll stay with chiropractic as long as there's no pressure. But when the kid's running 104 and grandmother comes down and starts ranting and raving and kicking and screaming, if you don't take that child to a real doctor, I'm going to call the police, that's when the Rice Christians fall apart. You know what Rice Christians are? These are the converts who are not really converted. They just convert so they get fed. And they'll be Christians. They'll sing all the right hymns every Sunday as long as you feed them. But then when the famine comes or when the storms rage, they go back to their own pagan gods because they never really believed in the first place. There are people who are fair weather chiropractic patients, who are Rice Christians in chiropractic. When they get out under pressure, they're going to collapse. Now, there's some that you can't do anything about because the superstitions are so deeply ingrained into them. The fear has been so ingrained into them that common sense and logic can't take over. What they have learned to do is when they're really in trouble, you dump the responsibility on somebody else. Doctor, it's your problem. You tell me what to do. Now, they'd like to dump it on you, but you won't accept it. So now they're going to turn to somebody else to tell them what to do. And if the kid dies, well, we did everything possible. If they do what's right and the kid dies, they feel guilty for the rest of their life. So there's some people that are going to fall away in any case, to keep that number at its minimum. You can't educate the people once and then walk away from it. You can't educate the people with your words and do other things with your actions. You've got to educate them once and reinforce that education just a little bit every time they come in by talking about the right things. I would also suggest in every practice that seriously wants to make an impact on the world, on the thinking of the world, you must have a continuing education program. You can't do it with a layman lecture alone. That's only touching the surface. We've got to take what we've talked about during these 10 or 12 hours or whatever it is, our philosophy talks, and share that with the patients. Wouldn't it be wonderful to get all your good patients together one Monday a month, or maybe every Monday for a month or 6 weeks? Let's do 6 one-hour sessions of sitting the people down and teaching them about inductive and deductive reasoning, teaching them about the triune of life, teach them that there's an innate awareness of every innate need, teach them to trust their innate intelligence instead of the educated intelligence of the thinkers. When they trust your educated intelligence, they will trust more the educated intelligence of the MD. Why? Because they already know from their television exposure and everything else that the MD has more intelligence than you and more education than you and is better trained and better qualified. If they want inductive judgment, they'll start off with you because you're cheap. But then when the chips are down, they're going to go to the other guy. And even the MD won't be good enough for them then. Then they want the specialist. Why? Because he has more inductive training. If they have a dependence upon inductive reasoning, you're pushing them in that direction constantly. We've got to turn them around and teach them the principles of deductive reasoning. Teach them how to think logically, how to trust their body, how to know. Yeah, they must know there are limitations. They must know that there are limitations of time, limitations of matter. The body's not indestructible. There are times for emergency first aid. The only trouble is nobody knows when those times are. And let's teach them that. I mean, they are forced to make guesses in the absence of knowledge. Why not tell them that? Tell them the truth. The only way you'll set them free to make valid, decent judgments for themselves and not dump it onto somebody else inductively is to share your philosophy in an ongoing, continuing education program. It's not going to be easy for you who only think about this philosophy. It's easy for me. I talk about it all the time. I've been teaching it for God knows how many years, so it comes naturally to me to find the words and the explanations and the sequences. And it won't be easy for you when you first start it. But I learned it by doing it. And that's how you'll learn it. You got the tapes now, these tapes and others, put them together, put your own little lecture together, come up with all you need is a half an hour talk, and then maybe an hour question and answer session afterwards. And then next week, do the same thing again. Take the next phase of our work. All you can do is take one of these tapes home and study tape 1, and then talk about it for 20 minutes. It's an hour's tape. Talk about it for 20 minutes and take questions. Then you get to tape 2 and do the same thing. I bet if you took the good patients in your practice and ran them through that kind of a continuing education program, you would uplift their knowledge, their understanding, and their commitment. And then they'll be the people that get excited about chiropractic, and what are they going to do? They're going to refer others. You see, when you understand this chiropractic principle, how the hell can you go home and bring your kids in to have their spines checked and see their little playmates walking around subluxated? What kind of a parent could turn his or her back on the kids next door? Once you have this kind of knowledge, you're going to share it. The fact that your people are not referring in droves means they're not committed. They have nothing to get excited about. They've brought their television to you and you've repaired it, and they're not going to tell anybody. Unless somebody comes to them and says, well, my picture tube's broken, my back hurts. Oh, go to my chiropractor, he fixed up mine. You've got to change the entire tenor of your practice. Turn it around and make these people subluxation conscious. Let them understand and fully understand the reasons for being subluxation free, how important it is in their life. I have a music teacher in Philadelphia who will not accept a student in her class unless that student gets a spine check regularly. Because she says there's no way these people are going to reach their potential of control of their voice and use of their voice as an instrument if they're walking around with nerve interference. That's understanding. And they don't get that understanding from nowhere. They're going to get it from you. You've got to share it. I mean, there's no point in you sitting here nodding your heads and then go home and do the same thing. If you go back to your practice tomorrow, if the people listening to this tape listen to it and then go right back to their practice and do exactly what they did before, nothing is going to change. We talked about the law of cause and effect. You are the cause of your practice. Now, if you like your practice the way it is, don't change anything. If you would like to see the practice change, then change its cause. And that's you. You can go home from here right now and make a little list. Somebody asked me, what can I do to build my practice? I said, that's easy. First thing I want you to do is make a list of all the things you know you should do to build your practice. And they made a list, 10 or 12 things. I said, good, go home and do those. What the hell do you need me for? You know what to do to build your practice. Just do it. Instead of which we come here, we sit, and we nod, and then we go home and we do exactly what we did yesterday. Nothing is going to change. If you want it to change, look, if you're happy with your practice, don't change a damn thing. If you're not happy with it, change what causes it. What causes the practice is you. If you want the practice to change, you change. Don't go home and try and change the practice. It's only a symptom. It's only a result. You're the cause. See you next time.